And some of the supplements we encourage our babies to be given, we have antihelminthics, yani dawa za minyoo. Ni mtoto wako kama hawezi akameza hii ya tembe, utampatia hii ya syrup, ndio ueliminate hizo minyoo kwa mtoto. Manake minyoo pia ni sababu moja kuu ya kucause what we call malnutrition kwa watoto. Jambo lingine, unapata mtoto anaharisha, anatapika huku na huku. If you are near the chemist, you can go and buy what we call ORS. This is what we call ORS. ORS, you can dilute it. This is one sachet recommendable. You take 500 ml bottle of drinking water. You put the whole sachet inside. You dilute it well so that the baby is able to consume it well. Sometimes the baby cannot be able to take it well. It's recommended you can take a clean spoon and give it slowly. Mpembeleza kunye hiyo dawa, manake ni nzuri na ni amana sana kwa mwili. Na sometimes we have what we call zinc supplementation. This is here. It's very good for the baby. So once the baby is having diarrhea and vomiting, you can, if you are near the chemist and the hospital is not around, kindly ensure the baby takes, below 6 months you can give it half of it, and above 6 months you can give the whole of it. I really recommend, sometimes you can give it with a little water, or sometimes you can express your breast milk, you dilute it well, that's when the child is below 1 year, and give it to him or her. This thing has main benefits to the baby. One, it boosts immunity to the baby, and at the same time it helps to stop the diarrhea and vomiting, and there are many benefits to the baby, like skin improvement. Also, we cannot forget about the probiotics. Probiotics are very essential, especially the Cosflora. This is the one I have used for in most cases, and it's cheap, readily available. So the Cosflora is also good and nice for our babies. Make sure you give the baby. This one is going to stabilize the normal flora of the stomach, so that even if the baby is diarrhea and vomiting, this one can replenish back the normal flora. And you give it in a half of the glass. You give it slowly and make sure the baby finishes. And until 45 to 1 hour, that's when you are able to introduce another feed or food to the baby. Also, there's here vitamin A. Vitamin A, this is according to age of the patient. So below 6 months, we can give vitamin A according to the age. That is, we have the 200 international unit and the 100. So with this one, when you go to the doctor, he or she is able to explain you further which one is recommended for our babies. And also, since the baby has been diarrheaing and vomiting, maybe has worms, at the end of the result, you get that the baby is having anemia. Number one remedy, make sure the baby is taking a lot of vitamins at home. That's a lot of fruits at home. Make sure the baby is taking a lot of vegetables. And these vegetables, when they are being prepared, make sure the green content is not being lost, because at the end of it all, if you lost it, some of the components you get, they have been lost. That is the home remedy. And sometimes you can buy the beetroots and make the juice for the baby to take. And coming to the clinic or to the chemist, whereby maybe the hospital is very far, the clinic, we can go to the hospital and buy this syrup, Ranfelon, recommended for use. This one is according to the age. I think the doctor in the chemist is able to prescribe you well and give you what is recommended. And to our pregnant mothers, this history of malnutrition starts from pregnancy. When the mother is pregnant, ensure that you take a good supplementation. Otherwise, you get a baby who is low for the age. Sometimes you can get a baby who is a premature. A premature baby is a baby who is born before the dates. So if you are able to take the supplements as well as possible, especially if you realize you are pregnant, that is maybe 1 month, or you are preparing to get the pregnancy, we encourage you to take the folic acid in advance. The folic acid in advance, this is the folic acid. You take the folic acid in advance so that, remember, during that time, that's when you have a lot of vomiting and you are not able to eat well. So if you take it in advance, it will ensure that you get a healthy baby, a baby with all organs functioning. Those who are not able to take the syrup, we recommend the tablets here, which is also, it's a combination of folic acid and other components, but they are really good. This is Orova capsules, so you can take them. They're also good for you. So I think I have explained some of the supplements to take, and there are many others, like when you are pregnant, you need to take Fansida. Fansida in such a way you prevent your baby from getting malaria, or you yourself getting malaria. So thank you. Kindly subscribe, comment and share. Thank you for watching, and thank you for supporting me.